Welcome to Understanding ICD-10-CM. This is a video on the ICD-10-CM coding conventions. Coding conventions are instructional notes, punctuation marks, abbreviations, and symbols that are used throughout the ICD-10-CM to provide direction when selecting codes. Instructional notes appear in the alphabetic index and the tabular list. The first is the includes note. This notation is used to define and/or give examples of the content of a particular category or block of categories within the ICD-10-CM codebook. There are two excludes notes. Excludes 1 means that the terms listed are not coded in the category or subcategory. It means not coded here. Excludes 2. This note is used to signal that the terms listed after the note are not part of the conditions represented by the code or code block. It means not included here. C. This is used in the alphabetic index and instructs the coder to cross-reference the term or diagnosis that follows the notation. C also. This is also a cross-reference note that refers the coder to another location or main term in the index. Use additional code. This notation appears in the tabular list and instructs the coder to use an additional code to identify the manifestation that is present. Code first. This notation appears in the tabular list and instructs the coder to select a code to represent the ideology that caused the manifestation. This code is sequenced first. In diseases classified elsewhere, codes with this title are a component of the ideology or manifestation convention. The code title indicates that it is a manifestation code and is not permitted to be used as a first listed or principal diagnosis code. Code also. This notation is used to indicate to the coder that two codes are needed to fully code the diagnostic phrase. The note does not provide sequencing direction. Punctuation marks. Punctuation marks are used in both the index and the tabular list to provide guidance to the coders when selecting codes. Parentheses are used in both the index and tabular list to enclose supplementary words that may be present or absent in the statement being coded. The code assignment is not affected by the words that are listed in the parentheses. Non-essential modifiers. These are terms that are found within the parentheses. Brackets. Brackets that are used in the tabular list to enclose synonyms, alternative wording, or explanatory phrases. Brackets used in the index identify manifestation codes. Colons. When used in the tabular list, after an incomplete term that needs one or more of the modifiers listed to make it assignable to a given category. Abbreviations. There are two abbreviations that are used. NEC, which is not elsewhere classified. This represents other specified. NOS, or not otherwise specified. This is interpreted as unspecified. Symbols. The point dash symbol is used to signal to the coder that the code contains a list of options at a level of specificity past the 3-character category. When selecting codes, the coder must follow all instructional notes present. Instructional notes, abbreviations, and punctuation provide direction to the coders. When cross-references are present in the index, the additional terms need to be referenced by the coder. Thank you for choosing UMA for your education.